So we're now going to move on to our next speaker, Vicki Bennett. So Vicki is a certified health informatician and health information manager with an extensive working history in the public and private sector in Australia and the Pacific. Vicki is currently the unit head for MIMCU and is responsible for the National Health and Welfare Information and Data Standards work of the Australian Institute of Health and Welfare. She's held several international consultancies in the Pacific with agencies including WHO, World Bank and the Asian Development Bank. From 2008 to 2010, Vicki was the Technical Director of the HIS Knowledge Hub for Health at the University of Queensland. Vicki is on the board of the Health Information Management Association of Australia, a member of the Australasian Institute of Digital Health, and is the president of the International Federation of Health Information Management Associations and previous executive director for the Western Pacific region. She's also been appointed by WHO as a formal advisor to the Pacific Health Information Network Board. Vicki will be providing the senior oversight for the Pacific Health Information Support Hub, in addition to being a country focal point and supporting the evaluation consultant engagement. So please join me in welcoming Vicki Bennett, who will be presenting on the establishment of the Pacific Health Information Support Hub.
Well, thank you very much for that introduction. Somebody else wrote my bio for me today, so that was interesting to hear what they wrote. And goodness, what an act to follow, Lenara. Thanks so much. This presentation was meant to be given by myself and my colleague Kate Spivey, but she was unwell, so she's not joining us till this evening. So apologies from Kate for being late. As my bio just said, I've been working in the Pacific now. I've worked out 21 years, which kind of makes me feel pretty old. But some of my colleagues in the room that I've been working with for many of those years. And the reason I got into working in the Pacific was I was implementing a new patient information system in my hospital. I was the patient administration manager at a private hospital in Canberra, and I was sitting in the basement, plugging in Crystal report code, trying to get all the reporting outputs set up. And I've been working, 60-hour weeks in the middle of this massive sort of project. And, I was dying. I was a mother of 4 kids in primary school, not even all in primary school, 4 small children. And the CEO walked into my dungeon area where I was working on this back-end system stuff and said, "You wouldn't want to go to Vanuatu for 2 months, would you?" And I went, "Yeah." He said, I said, "Oh, well, we've got a twinning relationship with the hospital in Santo there, and the Aussie people have reached out and said they need someone to come work on their medical records." And I said, "Yeah, I do want to go." And he said, "Oh, you couldn't do that. You've got kids and a husband." And I said, "You watch me, I'm gone." So we managed to get the system to go live. And then the next month, that was at Easter, and then the next month, I packed up my husband and 4 kids and off to Port Vila we went for 2 months. We had a 2-bedroom apartment. We all 6 of us packed in there for 2 months, and it was just the greatest experience ever. I got to see all the 5 hospitals. I got to go on these tiny little planes and scared the life out of me landing in some of those airports. It was such an adventure though. My kids went to the little local school, the Peter Pan school. My daughter celebrated her 10th birthday at the Cascades. We had just the best time, and it just started my love for the Pacific, I guess. And I guess that's why I'm still here today. The next thing I did, so I did that two lots of 2 months in Vanuatu, and then the next year I got a contract working with SUNIA in Tonga, and I was the health data dictionary specialist for them for the next 3 years on the World Bank project that implemented their first EMR HIS system. So, and then I got this really great opportunity to come and live in Fiji. I came here on a PACTAM, an AusAid funded project through AVI, Australian Volunteers International, and worked here in the Ministry of Health. And there's still some of my colleagues that I've worked at the Ministry of Health here that I'm in contact with. They're my Facebook friends. So I guess I'm just starting out this way to say the reason I'm here today is because I really love working in the Pacific, and I've really enjoyed all of the opportunities that it's provided me and my family. And I want to keep giving back to you guys. So I've had a few different jobs over the years. I've worked at the Australian Institute of Health and Welfare on and off since I returned from Fiji in 2007. I've also done obviously a bit more consulting on the side, but as mentioned, I ran the HIS Knowledge Hub for Health, the HIS Hub we called it, at UQ, and it was really interesting. AusAid at the time funded project that they saw that it was really good to sort of create these bodies that created evidence about best practice and what works well in certain areas. And there was one on maternal and child health, and there was other few ones, but the HIS Hub was great. And I kind of got headhunted to run that. But I always thought even back then, it would be much better, instead of putting it in a university, if it was embedded in a government department like AIHW where I work, and I'll talk a little bit about who we are, so that we could develop really strong institutional partnerships. A government agency is going to be there always, and the staff there are going to be there and get paid regardless of whether DFAT's funding it or not. So my vision was always to try and embed that. And as much as I like working for myself, I don't mind, you know, doing consultancy gigs, and people keep contacting me and saying, hey, can you do this bit of work or that bit of work? What I really felt like is that I needed to create a team of people so that it's not person dependent. What if I get hit by a bus? You know, like, who's the next person? How do I invest in other people that I work with to be able to be here for the next 20 years? So that's the plan and the vision. So we approached DFAT and we said, look, could we set up something? And anyway, I wanted to have an acronym that we could say. So we created the acronym PHISH. So Pacific Health Information Support Hub, which is great because we can then have cool logos with fish. And we can say we're going to swim around the Pacific helping people, and, you know, we can take the analogy as far as it goes. So maybe I'll just tell you a little bit to start with about the Australian Institute of Health and Welfare. Some of you may know who we are, but we are a government department. Well, we're not a department. We are a separate agency, but a government agency that we have our own board. So we don't actually speak to the Minister of Health, which is kind of why we were set up, to be a little bit independent, because in Australia we have the states and territories and the Commonwealth, and there's not always a lot of trust between levels of government. And we were kind of set up to be the honest broker. Everyone could give us their data and we would report it independently without bias. So that's sort of the role that we have from a politics perspective, I guess, the small p politics. And we've been doing that for well over 30 years. We are now a team of over 600 staff, grown rapidly in the last few years, especially. And I think COVID has really like promoted the role of data, people, every morning we were waiting for those statistics. Health statistics became really, really sexy during COVID. Everyone's hanging on the ministerial announcement. So the role that we have in Australia, it started out as just the Australian Institute of Health, and then we became the Australian Institute of Health and Welfare. Because as we know, social determinants of health, and health is a social determinant of welfare. Like there's interplay between people's income, education, living situations are really, really important. We produce hundreds of reports every year on different topics. Some of those are disease focused, some of those are population focused, like we do a lot of work on our First Nations people reporting. We, as I say, you can see cancer screening programs. We do all the mortality. We don't produce the mortality statistics, but we report it in the context of understanding things like life expectancy from cancer. In my team, I run the Metadata Information Management and Classifications Unit, which sounds a long name, but we do all the health data standards development, health and welfare, but we come up with the national minimum data sets or data set specifications that are required to be reported nationally. And then we have here we go, this one. We have a tool, an online a metadata registry called Meteor, which is, again, really cool. It came out of MET from Metadata Online Registry. So that's been operating since about 2004. And last year we were able to launch a new version, which is this, sexy looking kind of page here, which is much cooler than the old one, which was 20 years old nearly. And the really cool thing about that is we were able to launch it on May the 4th. So Star Wars Day, Meteor on Star Wars Day. So that was the fun play last year. The other thing my team is involved in, and I'll be on a panel with Sina tomorrow to talk about the International Classifications of Diseases, the ICD. We are the WHO Collaborating Centre for the Family of International Classifications. So my team and I have been working on the development of ICD-11, and we also support the use of ICD-10, 10AM within our own contexts. So as I said, we should get to have cool fish swimming around in our logo. At this stage, we've been established with a 2-year funding program to support health information system strengthening activities in the Pacific region. We'll be working strongly with a couple of countries, but more generally with the region. And we certainly have some funding in our arrangements to support the PHIN, which is fantastic. The PHIN board that has recently been appointed, I must say, is striving in leaps and bounds compared to the previous board, who didn't meet at all. And I've got to say that there's 4 amazing women that are doing all the hard lifting there, which is fantastic. And Lenara is their leader. Fantastic. We also have a partnership with SPC. We have an MOU, and we plan to work very strongly and collaboratively with SPC. So we aren't going to be stepping on anybody's toes. We will be definitely ensuring that we work very strongly within existing networks. And our goal is to support better health policy through robust and reliable information, which is what we do in the Australian context. And our aim is to help you do that better as well. You probably, all of you know that we all, and all of your countries have probably been collecting a lot of data for a long time. What we really aim to do is help you turn that into useful information products, and that is used for actual decision making. I know I went to Vanuatu in 2009 and went out to see what they were collecting in the community health centres. The nurses had a 10-page form they had to fill every month. It had 600 data items they were meant to complete every month. Now, I can tell you the quality was pretty bad, because not only did they have to do that, and one of them told me it took her 2 or 3 days every month to fill up the form, but they never get anything back. And I think somebody mentioned this the other day, if we can't get information back to source, we lose the motivation of those who are required to collect. So I guess we need to make sure that not only a one-way street, but what we're producing as an output is actually useful to the people delivering services on the ground. So that's one of the things that I'm really passionate about. So in our program of work for PHISH, we have 3 main work streams. Listening and learning is a work stream specifically designed to hear what you have to say. What are your key priorities? As an advisor, I've always thought, I don't know what you need. You know what you need. Often what you need is me to be the loud voice to tell the funder, but what we want to do is make sure we understand your priority areas, what it is that is the right thing for you right now. One of the challenges in working in international development is that it's really difficult to achieve any kind of change if people don't feel the pain of the problem. If you don't see it's a problem, why would you make a change? So that's why it's really important for us to listen to you, to make sure we hear what is your pain point right now. What are the challenges that you are struggling with? So that first stream of work is about that. And we definitely we'll be doing a couple of countries with specific needs assessments, but of course there's a regional agenda as well. And then we'll be able to identify what responsive technical assistance it is that would be required in individual countries or across the region. So I think that's really important. The second work stream that we have there is connecting and collaborating. Again, this is the sort of regional focus, more of the program of work. Regional resource sharing is something we've heard at the FIN meeting, for example. People were saying, oh, we all need to develop cybersecurity policies. We all got to struggle in that area. Well, why would we develop a cybersecurity policy differently in every single country? Could we not develop one and make it a model or a template and host it somewhere so it's available for other countries to use as well? And I think what we'll be doing there is partnering with SPC on this so that they can have a hosting environment for these types of resources. We can help with the development of them that are responding to the needs of the countries that we found in the listening and learning stream. Lenara mentioned the fact that a digital health strategy is really important. I know many of the countries are planning to do that. Well, how about we find a really good way to create a template that's really good for everybody to learn, so you can plug in your local stuff, but you don't have to reinvent the wheel, and you don't have to pay 22 Pacific Island countries and territories, every country paying a separate digital health consultant to come in and write their digital health strategy. Why don't we share that knowledge so we get that, South-South learning, or whatever we're calling it. The second thing there, regional information and support network, that's kind of the, how do we help you collaborate? How do we facilitate some of those things? As I mentioned, we're the WHO Collaborating Centre on Health Classification. So in our arrangements with WHO, they have asked us to support the Western Pacific region more generally in the use of ICD, whichever version it is that you're on or planning to go to. So we have some funding allocated in there to do that. And recently we've been working with WHO, for some of you who do work in the ICD space, helping with some webinars on ICD-11, and we'll continue to do that kind of work. And I know like Fiji and Samoa and Tonga are doing ICD-10 AM coding for their morbidity, hospital coding. And one of the things we'd like to be able to do, say, for those countries is perhaps assist with some data quality activities, audits, things like that, because those 4 countries have been doing that for nearly 20 years. And there hasn't been a lot of that feedback. So that's something we're also able to do with some of this funding, if that's of interest to you. And as I mentioned, regional activities of the PHIN. At this stage, the PHIN board, we're hoping to support them meeting in person every 6 months, which will be fantastic to continue to facilitate that. And some of that funding we're going to use for bringing the PHIN board for an in-person meeting in Brisbane in end of October, beginning of November, which will coincide with the IFHIMA Congress. So that's in my bio, you heard I was the president of the International Federation of Health Information Management Associations, short name IFHIMA. And the Congress that happens every 3 years, although it's been 4 years because of COVID, is happening in Brisbane the last week of October, first week of November. So we'll be able to fund the PHIN board to come there, and they are going to present at the Congress about the things that are happening in their own countries. So Lenara gets to do this again, but she's only got 15 minutes there. And just to share the knowledge of what's coming out of the Pacific, because I can tell you what's happening in Samoa is a hell of a lot better than what we've got in Australia, right? So I think that comment about leapfrogging over at the developed world is definitely high-income countries are suffering with legacy issues. Getting rid of old systems is harder than just putting something new in a greenfield site. You know, we have a national health identifier in Australia, an individual health identifier, an IHI, but it's not used in all of our systems. So, you know, we have a long way to go. So lots to learn from the Pacific, and I'm really looking forward to be able to have some of our Pacific colleagues present at the IFHIMA Congress. We'll also organise some site visits for them to visit some hospitals, the Queensland Health Department and the Australian Bureau of Statistics, who does our mortality coding. So supporting a PHIN is definitely on our agenda and things we're supporting. And the third work stream there is seeding for sustainability. And this is all about training and mentorship. Again, I'm hoping that our work with the PHIN board is an opportunity to invest in, as I say, at the moment, 4 amazing women. There's Lenara from Samoa, there's Mana from PNG, there's Mina from Cook Islands, and Rebecca from the Solomon Islands. I see a really great opportunity for those 4 women to just grow in strength as they operate in a regional leadership capacity there. We also hope coming out of the PHIN is going to be doing a training needs survey, and some of the things that are identified through that survey, we're hoping that the PHISH can support. We can find out the needs through PHIN, and the PHISH can deliver. That's my thinking, right? So the other good thing is that AIHW isn't the only player here. We obviously internally, we have a huge network of staff with different kind of skills. We've got people who understand ethics, privacy. We've got things like burden of disease analysis capability. We have a COVID register for Australia. We do lots of NCD reporting. We run the Australian, we report on the health expenditure in Australia. So we also provide all of the health expenditure data for Australia to the OECD. So we've got really good skills in expenditure analysis and performance reporting. We produce the My Hospitals website, which compares hospitals on their waiting times and things like that. We have a huge focus these days on data linkage, and which is really important in a country like mine, where all the systems aren't connected by one number. So you have to do probabilistic and deterministic matching between sources to get the whole picture. So a lot of work happens there. And we have a lot of specialist collections around things like disability, child welfare, tobacco and drug and alcohol services, injury surveillance, lots of cool stuff. That's our internal capacity, I guess. But we have really strong partnerships externally. We have really strong arrangements with PHIN, as we mentioned, who are all the health information and digital health specialists in the region. We have the MOU with SPC, which we're excited about. We are the WHO Collaborating Centre and really strong connections with Wipro. I was recently in Manila working on the Western Pacific region's digital health strategy with Sonia and Sina and Walter and Georgina from the Pacific, which was fantastic. And I'm about to head back there to hopefully represent you as well as I can on the Universal Health Coverage Technical Advisory Group. We have very strong relations with our Australian Bureau of Statistics, who are the ones who produce our mortality data, and they work with us as part of the Collaborating Centre for WHO on health classifications as well. And then we have more informal relationships with agencies like Vital Strategies, who are doing a lot of mortality work, and the Brisbane Accord Group, again, working on CRVS. So I guess our aim is that we aren't, we've called ourselves a hub because it's the kind of idea is that it's a hub and spokes, that the connections are going to help us deliver. And if we're not if you come and ask us for some support, and we're not the ones who are expert, we can reach out to those other people within our networks, both internally and externally, to provide the right advice, assistance, whatever that is. And I guess the idea is that this becomes a long-standing, enduring institutional partnership between the AIHW and you in the region, so that you know that we're always on the end of the phone, we're always on the end of an email. If you've got an issue, anything to do with health information systems and digital health, you go, oh, we can reach out. We don't have to put out a tender and get a consultant and to answer my question. We're there to support you when you need it on whatever that issue is. This at the moment is my team. Kate will be joining us for tomorrow, so you'll meet her tomorrow. I have a team of about 18 staff, but these are the ones who are sort of predominantly dedicated to this piece of work. Nicola Richards might be familiar to some of you. She worked with me back in the HISHub days, and she's been working mostly on CRVS around the region ever since. Karen Mallum is a long-standing colleague at the Australian Institute of Health and Welfare, and she's currently living in the Solomon Islands because her husband's there on a posting, and she'll be helping with some work. Navreet Patel is a colleague of mine who's now just had a baby, so she's on maternity leave inconveniently right now, but she's also worked with WHO in the Western Pacific. And Neil O'Driscoll is another fabulous colleague of mine who runs my metadata team. So he's the one who develops most of the health data standards. So when we get to doing any sort of data standards development, he'll be the guy probably leading that work. That's all I have, but I'm very happy to answer any questions you might have.